Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. In the previous sessions, we have discussed about what is a human resource management department and what are the two major objectives as well as functions that are carried out by human resource department. In this session today, we are going to discuss about the role of a nurse in human resource department. But before we move on to today's topic, let us quickly recall what we studied in our last class. So we have seen that a human resource management or a human resource department is available in each and every organization, and it deals with the management of the human beings within the organization. We know that every organization has human beings who work towards the organizational goal, and the entire process of managing the human resource working within an organization is called as human resource management. Now, as the term suggests, the human resource department looks after the recruitment, the selection, the placement, giving the job description, the salary that is provided, the leaves that are given to the people within the organization, and also works towards the welfare of the employees within the organization. We also discussed that there are two major objectives of human resource management, which is the primary objective and the secondary objective. The primary objective of a human resource management department of any organization is to motivate their employees enough so that they contribute maximum to the output of the organization. And there are several secondary objectives such as maintaining a good relationship within the organization at all levels, having a proper channel of communication within the organization, to provide fair wages to the employees, and also helping the organization to get the required number of employees, train them as well as retain them. Now, let us move on and see what is the function or role of a nurse in human resource management. We are talking about the human resource management within the hospital, and therefore a nurse plays a major role in managing the human resource of the organization, because many number of staff nurses, many number of nursing professionals are required to run any hospital. In the human resource management team of the hospital, there is always a nurse manager present in the group. So from all the nurses working in the hospital, the nurse manager is the member of the human resource management department of the hospital. So we are going to discuss what is the role of the nurse manager in the human resource department. As a manager, when a nurse performs her duty, she should always follow certain principles in order to make sure that the human resource within the organization is managed properly. So there are certain set of principles that are to be followed by a nurse manager while she handles the human resource of the hospital. Let us see what are those principles. The very first principle that a nurse manager must follow is that whenever she develops a human resource management plan, it must be a realistic plan, because we have seen that to manage the human resource is not an easy task. Therefore, a nurse manager must always make sure that whatever plan she comes up with in order to manage the human resource, in order to manage the nursing professionals of the organization, the plan must be realistic. The second principle that a nurse manager must follow is that the selection programs, the socialization programs, as well as developmental programs that are provided to the human resource is according to the actual need of the organization, and those programs are meeting the need of the organization. As we discussed in the first principle, that the human resource development plan must be realistic. Here also, the nurse manager must make sure that she identifies the actual need of the organization, and whatever selection, socialization, as well as developmental program is curated for the employees within the organization, it must be proper and it must be according to the need of the organization. So the role of the nurse manager here is not just selecting the people or providing the developmental program for the staffs, but to ensure that she understands the need of the organization and all the plans are made according to the needs of the organization so that all those needs can be met. The third principle to be followed by the nurse manager is to make sure that she compares the actual performance of all the staffs working in an organization to a standard that is set for comparison. So whenever we evaluate something, we need to have a set of standard or a criteria against which we are going to compare ourselves. For example, if I want to evaluate the punctuality of the employees, as a nurse manager, I should give a particular time for the employees to report to the hospital, and I will compare the timings of the employees with the given timing. So the given timing is a standard criteria for the nurse manager to compare the timings of the employees. Similarly, like that, there should be a criteria that is fixed for the performance evaluation of the staff nurses. When we have the criteria ready with us against which the actual performance can be compared, it becomes so much easier for the nurse manager to evaluate the performance of each and every staff. The next important principle to be followed by a nurse manager is that she prepares or she develops a proper appraisal system for all the employees working within the organization. Another important role of a nurse manager is to make sure that each and every executives at different levels working within the organization are aware about the human resource philosophy followed within the organization. We have already discussed in our last session that a human resource philosophy is the belief, is the assumption of an organization about people, about their beliefs, attitudes, attributes, etc. The nurse manager must make sure that the human resource philosophy of the organization is implemented throughout the organization at different levels, and she should also make sure that different executives within the organization are well informed about the human resource philosophy of the organization. Another important role of a nurse manager is to make sure that the human resource or the staffs in the organization are developed according to the technological, the technical, and the leadership challenges as well as the requirement of the modern day organization, which means the nurse manager must make sure that all the staffs update their knowledge on a timely basis. They should have a proper knowledge about the technological advancement, the technical advancement, and also she should make sure that the organization functions as a modern day organization, which simply means that a role of a nurse manager is to make sure that all her employees are well updated with the knowledge, with the technological advancement that is seen outside the hospital setting so that they can function as a good modern day organization. Another important role of the manager is to match the performance of the employees with the organizational as well as social goals. So as a manager, I must supervise the work of the employees, and not just supervise the work, I must also see that each and every individual is working towards achieving the organizational goal as an individual as well as a member of a team. The next function of a nurse manager is one of the most important function, which is to make sure that the members in the organization have the team spirit. The organizational work culture includes team spirit. There is group cohesiveness, mutual respect, as well as a good communication system for the organization to function smoothly. So we are already aware that in a hospital, different patients are there and every different patient have different healthcare needs. In order to meet the healthcare need of one single patient, also different departments have to work together. It is not possible for any one single department to work towards meeting the need of the patient and they can achieve it. In hospital, it is always different departments working together to achieve one single goal for one single patient. So by this, we can understand that all the team members should work together. Team spirit, the teamwork is required. Group cohesiveness must be there, as well as the members of the team should have a sense of belonging. There should be mutual respect as well as a proper communication system in order to make work more effective, in order to make the organizational functioning more smooth. So it is the function of the nurse manager to make sure that all of this are present within the ward or within the organization. The next function of a nurse manager is also to make sure that the employees are satisfied with their job and they have a sense of pride in their workplace. We all know how important is job satisfaction. People would want to work only in such places where they get job satisfaction. It is the role of a nurse manager to see that the employees working within the organization, the staffs within the hospital are satisfied with their job as well as have a sense of pride for the work that they are performing. Another important function of a nurse manager is to make sure that she educates the other managers as well as other in charges to nurture and nourish the human approach, which means it is the role of a nurse manager to make sure that other in charges who are responsible for supervising the work as well as providing guidance to the junior staff in a proper human approach. Another important role of a nurse manager is to develop human resource policies, strategies, and plans. So it is the nurse manager who develops the entire plan of human resource, who develops the strategy as well as the policies to be followed in the human resource department. Another important function of a nurse manager is to give direction for all the human resource activities, and not just give the direction but also to ensure that it is implemented at various levels in the organization. Just before this, we have seen that it is the role of a nurse manager to develop a plan, strategy, as well as policy for human resource. Once it is developed, it is also the responsibility of a nurse manager to see that it is implemented at various levels within the organization. Moving on, let us see what are the different steps involved in planning manpower of the organization. So there are different steps in manpower planning of the organization. The very first step is to identify the need of manpower within the organization. As a nurse manager here, the nurse manager has to determine how many numbers of employees are required for a particular period of time for the organization to function in an effective manner. Now, how do a nurse manager do that? How will she be able to find out the requirement of manpower within the organization? The nurse manager, with the help of organizational chart, will count the total number of positions that are available so that new employees can be selected. The next step in planning manpower is to estimate the death that can occur within the organization as well as the retirement of the employees. So as a nurse manager, the nurse manager must not only be ready to hire the employees when there is a need in the organization, but the nurse manager must also estimate the death as well as the retirement of the employees in order to ensure that there is smooth functioning of the organization even when such things happen. The second step involved in planning manpower is to compare the existing employees working in each of the department, unit, or a section with the actual required number of employees. So these are two different things, right? There is a required number of employed and there are the total number of employees present. Sometimes there is a chance that the required number of employees is much higher than the number of employees who are existing in the organization, and sometimes there is a chance that the number of employees present in the organization is more than that is required for the organization to function. So in case if it is found that the required number is less than the existing number, then the nurse manager must estimate how much shortage is there and various provisions in order to hire new employees such as recruitment, placement must be carried out. In case the available number of the employees in the organization is more than the required number, in such cases the manager also has to plan how to get rid of extra hands, which means the manager also has to plan how she can remove the extra number of employees to decrease the financial burden on the hospital. This may be achieved by the organization through layoff as well as premature retirement. And finally, the last step involved in manpower planning is to determine what kind of training does the employee within the section in the hospital or as an entire department requires to function smoothly. So obviously, manpower is hired in order to perform certain tasks, and in order to perform certain tasks, they need to be trained according to the goal of the organization, according to the objective of the organization. Therefore, the nurse manager must make sure that she identifies the type of training that is required for the employees to have an overall development and to function smoothly. In this part, one of the most important thing that we have to understand that the training that is provided to the employee is not only given to the new employees. The training must be given to both new employees as well as existing employees to develop the knowledge of the employees. Now, existing employees, once they are inside the hospital setting, they only get exposure to a certain kind of patient and they may not have the knowledge about the outside world, the technological advancement that is happening in the world, right? In order to make sure that their knowledge is also updated and also to make sure that the new employees are well aware about the job that they have to carry out as well as properly trained, the training has to be provided to both the new and the existing employees. That is all for today's session. In this session today, we have discussed a very short as well as a very interesting topic, which is the role of a nurse manager in the human resource management, wherein we have seen what are the different kind of roles that she performs, as well as what principles are followed by the nurse manager in order to make sure that the department functions smoothly. We also discussed about the steps in planning manpower within an organization. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day ahead.